So now we're going to start the discussion about the anterior abdominal wall. Okay. So before that, you have to know some basic points about the planes and the quadrants of abdomen. Now we have three horizontal planes and two vertical planes. See, vertical planes are nothing but they are the line drawn from midclavicular point to the midinguinal point. So that is a vertical line. We don't have any name for that. So we're going to focus mainly on the horizontal plane. Okay, we have three horizontal plane. Now in the recent FMG exams 2021, 22, 23, we are getting questions about the planes and their vertebral level. Now first plane, transpyloric plane. So first plane, transpyloric plane. So transpyloric plane, it is a horizontal plane passing through the lower border of L1. So please underline horizontal plane at the lower border of L1. Right. Next, subcostal plane. It is a horizontal plane at the lower border of L3. And transtubercular plane, it is a horizontal plane at the upper border of L5. So it is the horizontal plane at the upper border of L5. That is a transtubercular plane. So lower border of L1, horizontal plane, transpyloric. Lower border of L3, horizontal plane, subcostal plane. Upper border of L5, transtubercular plane. Okay, right. Don't forget the vertebral level. Now, the transpyloric plane, there are some other structures. So now see the diagram. Now in the diagram, the one that is our transpyloric plane, L1. Number 2 is the subcostal plane. That is lower border of L3. And this is transtubercular plane, the upper border of L5. Now, transpyloric plane, we're going to read in detail. Now, we have some structures which are meeting at the transpyloric plane. Now, we're going to list out the structures which meet at the transpyloric plane. So, structures which meet at the transpyloric plane. Okay? Yes. Number 1, I told you the vertebral level. Transpyloric plane is passing through lower border of L1. Fine. Number 2, now the transpyloric plane, we also see the tip of ninth costal cartilage. Tip of ninth costal cartilage. Okay, right. Number 3, the name itself you have a clue. Transpyloric plane. What is present? Pylorus of the stomach. Pylorus of the stomach. Okay. Number 4, fundus of the gallbladder. Fundus of gallbladder. Okay. Then hilum of the kidney. Okay. Origin of superior mesenteric artery. Origin of superior mesenteric artery and termination of spinal cord in the adult. Termination of spinal cord in adult. Okay. These are the various structures which meet at the transpyloric plane. Okay. Now see the diagram. Now we're going to use this transpyloric plane and transtubercular plane and the two vertical lines drawn from the midclavicular line. By using these 4 lines, we're going to divide the abdomen into 9 quadrants. Okay. Now, what are the 9 quadrants of abdomen? From above, I am saying right and left hypochondriac region and the middle epigastric region. Below that, right and left lumbar region, the middle umbilical region. Right and left iliac fossa and in between hypogastric region. So by using those 4 lines, now we have 9 quadrants of abdomen. Okay. So 9 quadrants of the abdomen. Now we know the quadrants name. So we finished the planes of the abdomen and the quadrants of the abdomen. Just know the plane's name, the vertebral level, and you have to know about the transpyloric plane and just to know the quadrants of the abdomen. Right. Now, after finishing the planes of the quadrants, now we're going to see the layers of anterior abdominal wall. Okay, so the first layer, the outermost layer will be skin. If you remove the skin, we have superficial fascia. Superficial fascia is having 2 layers. This entire thing is the superficial fascia only. Superficial fascia. Now, superficial fascia is having two layers, fatty layer and the membranous layer. Fatty layer is called Camper's fascia. The membranous layer is called Scarpa's fascia. Okay, fatty layer, Camper's fascia. Membranous layer, Scarpa's fascia. Clear? Now, deep fascia. Deep fascia is absent in the anterior abdominal wall. So, deep fascia is absent. We have only superficial fascia with the two layers, fatty layer and the membranous layer. Next, muscle. What muscle? External oblique muscle. Muscle is oblique in direction, present outside, external oblique muscle. Then internal oblique muscle. Next, transverse abdominis muscle. And after that, we have one fascia, transversalis fascia. And deep to that, we have peritoneal layer. Okay, external oblique muscle, internal oblique muscle, transverse abdominis, and then fascia transversalis, and then peritoneal layer. Okay, so the neurovascular structures present between, the neurovascular space is present between which two muscles? Now, see the diagram. The neurovascular plane is present between the cut section diagram. Now, this is our external oblique muscle. Okay, then deep to that, internal oblique muscle, and then transverse abdominis muscle. Now, see the nerve. The nerve is passing between which two muscles? Internal oblique and transverse abdominis muscle. So, neurovascular plane in the anterior abdominal wall is present between internal oblique and transverse abdominis muscle. Transverse abdominis muscle. This is very important. Okay, all the arteries and nerves in the anterior abdominal wall is passing between internal oblique and transverse abdominis. Clear? Right. Now, next. Now, in the exams, yes, you have to know the actions of these muscles. That is more than sufficient. They're not asking the origin insertion for external oblique, internal oblique, and the transverse abdominis. Just to know the muscle actions. Okay, that is more than sufficient. So, the point is, no need to know the origin insertion for these oblique muscles and the transverse abdominis muscle. Okay, so now this is the diagram. So, in the diagram, yes, we are seeing we remove the skin, the superficial fascia, and first muscle, external oblique muscle. And if you remove the external oblique, deeply you see internal oblique, and then deep to internal oblique, we have transverse abdominis muscle. Now, these muscles, they are forming aponeurosis. So, this white structure is nothing but it is the aponeurosis of the anterior abdominal wall muscles. Now, what they do? They are forming one sheath. That sheath covering the rectus abdominis muscle, pyramidalis muscle, and it also contains some arteries. So, that sheath is called rectus sheath. So, rectus sheath is formed by the aponeurosis of anterior abdominal wall muscles. So, the aponeurosis, please write, the aponeurosis of external oblique muscle, external oblique, internal oblique, and transverse abdominis. Okay, they form rectus sheath. Okay, right. Now we're going to discuss the rectus sheath formation. The rectus sheath formation, we have to know about this line, arcuate line. Now, the contribution for the rectus sheath above the arcuate line and below the arcuate line, they are different. So, the demarcation point is the arcuate line. So, arcuate line is nothing but it is a midpoint between the umbilicus and the pubic symphysis. So, first point, arcuate line, the midpoint between the umbilicus and the pubic symphysis. Now, above the arcuate line, the rectus sheath contribution is different. Below the arcuate line, again, that will be different. Now, come to the diagram. I told you the aponeurosis of external oblique, internal oblique, and the transverse abdominis. So, each muscle is having two lamellae. So, the oblique muscle and the transverse abdominis, each muscle having two lamellae, having two sheets or two lamellae. Okay. What are those? Anterior and posterior. So, external oblique having anterior lamellae and the posterior lamellae. Internal oblique having anterior and the posterior lamellae. Transverse abdominis again anterior and the posterior lamellae. So each oblique muscle and the transverse abdominis muscle having two lamellae, anterior and posterior. Okay. Yes. Now we're going to draw the rectus sheath above the arcuate line. Okay. Rectus sheath formation above the arcuate line. Now first we draw the content. Now for example, this is the rectus sheath content, rectus abdominis muscle say. So this is the muscle, rectus abdominis muscle. Now this is front side, cut section we are drawing. This is anterior and this is posterior. Now please remember, posteriorly we have the fascia, that is our fascia transversalis. I told you, the oblique muscle, external oblique, internal oblique, and the transverse abdominis. Yes, they only forming the rectus sheath. So posteriorly, more posteriorly, draw fascia transversalis. Right. So now we're going to draw the lamellae. So first one, the external oblique muscle. Now the external oblique muscle, the two lamellae, they are passing in the front side like this. So two lamellae of the external oblique, they are passing in the front side, anterior contribution. Okay. Next one, internal oblique muscle. The internal oblique muscle, anterior lamellae passing in the front side and the posterior lamellae is going back side. This is anterior and posterior lamellae. Okay. Now next one, the two lamellae of transverse abdominis, they are passing posteriorly. So transverse abdominis, the two lamellae are passing like this. This is anterior lamellae of transverse abdominis. This is posterior lamellae of transverse abdominis. They are passing posteriorly. So rectus sheath formation above the arcuate line, anterior wall is formed by, we have two lamellae of external oblique, two lamellae of external oblique, and anterior lamellae of internal oblique. Yes or no? Very good. Now what about the posterior wall of the rectus sheath? The rectus sheath posteriorly above the arcuate line is formed by posterior lamellae of internal oblique, posterior wall is formed by posterior lamellae of internal oblique plus the two lamellae of transverse abdominis. Clear? Yes. This is about the rectus sheath formation above the arcuate line. Below the arcuate line is very simple. Now the rectus sheath formation below the arcuate line. Below the arcuate line. Okay. Now this is our rectus sheath content. Fine. Now this is our external oblique. The two lamellae of external oblique, again they are passing the front side. This is anterior, this is posterior. Posteriorly, I told you the more posterior structure will be the fascia transversalis. This is fascia transversalis. Next, internal oblique. So internal oblique, again the two lamellae passing in the front side. And this is our transverse abdominis. Again the two lamellae of transverse abdominis, they are passing in the front side like this. Okay. So all the lamellae of the external oblique, internal oblique, transverse abdominis, they are giving contribution to the anterior wall of the rectus sheath. Now the posterior rectus sheath below the arcuate line, what we have? Only one fascia. Which fascia? Transversalis fascia is present. Okay. Now see the diagram. Now in this diagram, first above the arcuate line. Now see the diagram. Now you're seeing the muscles, rectus abdominis muscle. Okay. Now this is our outer muscle, external oblique. This is anterior and this is posterior. Now this is our external oblique muscle. Now see the two lamellae, they are passing in the front side, anterior wall. Now internal oblique muscle, see here it is dividing. The anterior lamellae is passing in the front side and the posterior lamellae is forming the posterior wall, going on the back side. And transverse abdominis, can you see the transverse abdominis? Transverse abdominis, both the fascias, they are passing on the back side. So the anterior wall of the rectus sheath above the arcuate line is formed by the two lamellae of external oblique and the anterior lamellae of internal oblique. The posterior wall of the rectus sheath above the arcuate line is formed by the posterior lamellae of internal oblique plus the two lamellae of transverse abdominis muscle. Fine. Next, below the arcuate line, Now below the arcuate line, see the diagram. This is front side, anterior, and this is back side, posterior. Now your external oblique, internal oblique, trans abdominis, they're all forming the anterior wall only. In the posterior wall, what we have? Nothing we have, only one fascia. Which fascia? Fascia transversalis. Okay, so posterior wall of the rectus sheath, we have below the arcuate line, we have only one fascia. What fascia? Fascia transversalis. Okay, so remaining all the lamellae, they're giving the front side, anterior wall. Okay, now what are the contents of this rectus sheath? So now we know the rectus sheath formation. Now we're going to discuss about the contents, muscles, the rectus abdominis muscle, and we also have pyramidalis muscle. Now pyramidalis muscle, it is taking origin from pubic symphysis. Okay, and inserted to the center white line in the anterior abdominal wall, center white line, linea alba. Alba means white, line means line only. So insertion to linea alba. Now what is the action, sir? Now action of the pyramidalis muscle, it tends the linea alba. Okay, now supply, it is applied by subcostal nerve. Subcostal nerve is nothing but T12. So these are the basic points you have to know about the pyramidalis muscle, right? Next, rectus abdominis muscle. The rectus abdominis muscle origin from pubic crust and pubic tubercle. Okay, insertion to 5, 6, 7 costal cartilage. The 5, 6, 7 costal cartilage here. Right. Nerve supply T7 to T12 intercostal nerve. Okay, fine. Action? Yes, that we see in detail. So we're going to see actions of all the anterior abdominal wall muscle. This is very important. If any question coming from this topic, that will be from the actions only. So actions of anterior abdominal wall muscles. Number 1, the anterior abdominal wall muscle, it maintains the tone. It maintains the tone of anterior abdominal wall. Number 1. Number 2, it is giving protection to the organs. Okay, Dusara. Number 3, it is increasing the intra-abdominal pressure. Intra-abdominal pressure, and this is helping for defecation and micturition. Okay, the central story only. Action at the vertebral column. This is what a question. So in the vertebral column, we have 3 actions. Number 1, flexion. Number 2, lateral flexion. Number 3, rotation. So these are the 3 actions. Okay. Now flexion is mainly done by rectus abdominis muscle. Flexion is mainly done by rectus abdominis muscle, and the oblique muscles and the trans abdominis, they also help. So main muscle is rectus abdominis muscle, and other muscles, they giving the contribution. Okay, the external oblique and the internal oblique, they also help the rectus abdominis. The main muscle, rectus abdominis only. Next, lateral flexion. Lateral flexion is done by ipsilateral, same side, external oblique and internal oblique. Ipsilateral, external oblique and the internal oblique, same side, lateral flexion. Now rotation. Next, rotation. Now rotation is done by ipsilateral external oblique muscle and also by contralateral internal oblique muscle. If you want to rotate the trunk, same side external oblique muscle and opposite side internal oblique muscle will help. So these 3 are the questions. So flexion, main muscle, rectus abdominis. Lateral flexion, same side, ipsilateral, external oblique and internal oblique. Rotation, yes, ipsilateral, external oblique, on the opposite side, internal oblique muscle. Okay, right. So these are the muscles and the actions. Next, so apart from muscles, we also have arteries. Superior epigastric artery and the inferior epigastric artery. the anastomose with each other inside the rectus sheath. Okay, right. Now, this inferior epigastric artery, it is presenting in the peritoneal fold. That fold is called lateral umbilical fold. Okay, so lateral umbilical fold contains inferior epigastric artery. Please underline. The inferior epigastric artery is present in the lateral umbilical fold. Okay, next, medial umbilical fold. The medial umbilical fold contains obliterated umbilical artery. We also have median umbilical fold, which contains urachus and its remnants. Okay, so we have threefold: median, medial, and lateral. So median umbilical fold, urachus; medial umbilical fold, obliterated umbilical artery; and lateral umbilical fold, inferior epigastric artery. Okay, so in the recent exam, 2023 NEET exam, March NEET, they gave this question: medial umbilical fold contains urachus. Okay, now we're going to see the animations for the anterior abdominal wall. We are removing the skin, we are removing the superficial fascia, and we are seeing the external oblique muscle. Now, external oblique muscle, see the action of external oblique muscle. External oblique muscle is helping for lateral flexion. See here, the trunk is moving like this. Lateral flexion of the trunk. Now, we're going to remove the external oblique muscle and we are seeing the internal oblique muscle. Now, internal oblique muscle also doing the lateral flexion along with our external oblique muscle. See here, trunk is moving here like this. Lateral flexion. Now, we're going to remove the internal oblique muscle and we are seeing the transverse abdominis muscle. That is our transverse abdominis muscle. Right. Now, in the midline close to linea alba, we are seeing one long muscle there. That is our rectus abdominis muscle, and we also seeing some tendinous intersections. Now, what is the action of our rectus abdominis muscle? See the video. The trunk is moving in the front side like this. Trunk flexion. So, rectus abdominis muscle is helping for trunk flexion. Trunk is bending in the front side. That is the action of our rectus abdominis muscle. Now, we're going to see one modification of our external oblique aponeurosis. Now, the lower part of external oblique aponeurosis, you are seeing one thickening there. Now, that thickening is called our inguinal ligament. So, inguinal ligament is nothing but the thickening of aponeurosis of external oblique. Now, here we are seeing one small defect, and that is our superficial inguinal ring. Okay, so superficial inguinal ring is a defect in the external oblique aponeurosis. Now, I am marking that is a deep ring. The deep ring is a defect in the, yes, very good, fascia transversalis. So, now we are connecting the deep ring and the superficial ring. Now, we are getting the canal. That is our inguinal canal. Okay. Now, one last thing in the anterior abdominal animations, you are seeing one small muscle there. That is our pyramidalis muscle. Now, pyramidalis muscle origin from the pubic symphysis and it is inserting to this white structure, that is our linea alba. Okay, that is about the pyramidalis muscle. Pyramidalis muscle increases the tension of linea alba. Now, these are the animations you have to see in the anterior abdominal wall.